You're watching the Sunday Morning News on Global Calgary.
Welcome back. With the arrival of warmer weather comes beautiful blooms and plenty of pollen. Allergy season is here, and this year it might feel like it's a little worse than normal. Joining me this morning is Chiew from London Drugs, a pharmacist there to talk about allergies, and it's something we see at this time of the year, but it may seem worse this year, and why is that?
It's just because of the long winter. The spring season was delayed. Because of that, it might just seem like, oh, why is it lasting so long when usually it's over by about now or early in the summer here.
Right, and I guess it would be a more slow process in terms of how things bloom. This seems like it's just all of a sudden, this past week, all come up.
Yeah.
Okay, so for people who are suffering from allergies, there's a couple of different ways that maybe you can tackle them before going to see your doctor, right?
That's correct. If you go in and see your pharmacist, there's a lot of over-the-counter options that you can try first for a few days to see if it does work. If it does work, usually you'll find relief after taking it within about a half an hour, 45 minutes there. Several different options where you can take once-a-day pills that are non-drowsy. If you think you only need it during the evening time, some people get attacks in the evening after they've cut their grass, mowed their lawn, need a rest. There's ones that causes drowsiness.
Okay, those are kind of more of those Benadryl ones there? Okay.
And some people just have itchy water eyes, and that's all the symptoms they have. So they can either flush it out with some eye drops or actually antihistamine eye drops as well too.
Okay, and then there's also things for kids and that sort of thing, and also some nasal sprays?
Yes, so what happens is sometimes when you wake up in the morning time, it might feel really congested in the sinuses there. So you can use either decongestant nasal sprays, and they don't recommend to use them for more than about 2 or 3 days at the most, because it can cause rebound congestion, where it might feel like it's worse after if you use it consistently more than 3 or 4 days there.
Oh, okay.
So they suggest as well too to use a good sinus rinse, where once you spray it into the nose, it actually just flushes all the nasal mucuses that might be in the sinus cavities to help you breathe a little bit easier.
Right. Do you find sometimes people, if they haven't had allergies or they haven't experienced it, all of a sudden it can kind of come on and they can feel like they're suffering from it? Is that typical?
Yeah,
or possible?
And that's why you want to check with your pharmacist just to make sure to see if it is a cold that you might need to go see, take other medications for, or if it's been delayed. But if it is an allergies, this will help take care of it, and it's something that definitely a pharmacist can help you determine.
And if you're affected by them, I guess there's activities that you can try to avoid. I mean, you don't want to stop going outside, but maybe you get someone else to mow the lawn for you. That's
exactly.
Right?
Yeah. Mow the lawn, or sometimes pollen is actually peak during the daytime when the winds are blowing and it's blowing all the dandelions away and such there. Trying to avoid situations like that, because usually it'll look like all of a sudden it's snowing, but it's actually the pollen that's actually being blown all around there. So those are times when you want to try to stay away there.
Okay, but obviously if you want some advice, you can go to London Drugs or any pharmacy?
That's correct.
Okay, which London Drugs are you at?
We're at the Beddington location.
Beddington, okay. Well, Chiew, thank you very much for coming in. Hopefully people are going to breathe and that sort of thing a little easier. Great tips. And if you want some more information, again, londondrugs.com or the Beddington London Drugs. Thanks so much for coming in.